An elderly woman once told her doctor, "I thought I was just getting old. But one day, I couldn't even remember my grandson's name." Her blood work came back normal. Her brain scans? Normal too. Her medications were the problem. Every year, millions of seniors start showing signs of memory loss, confusion, and even dementia. And shockingly, in many cases, it's not aging. It's the pills they're prescribed. The worst part? Most people, even their families, have no idea. Today, I'll reveal the 9 most common medications linked to rapid memory decline, confusion, and dementia in seniors, and what safer alternatives you can discuss with your doctor. If you care about your brain health, or the health of someone you love, stay with me. It could change everything. Before we dive in, I want to mention that in the description below, I've added links to several vitamins and supplements that can support brain health and help with issues like brain fog and cognitive decline. Be sure to check those out after the video. Now, let's dive into those medications that could be harming your brain. Anticholinergics, like Benadryl. You might recognize names like diphenhydramine, often used for allergies, colds, or sleep. But what you may not know is that these drugs block a chemical called acetylcholine, which your brain desperately needs for memory and learning. Acetylcholine acts as your brain's messenger system for forming new memories. When anticholinergics block this critical neurotransmitter, information simply can't travel efficiently between different parts of your brain. Research shows a 54% higher risk of dementia among those who use anticholinergics regularly. That's not just a small increase, it's a major red flag for anyone concerned about brain health. A woman in her 70s switched from nightly antihistamines to natural sleep aids, and within a month, she said her brain fog finally lifted. She described it as feeling like someone turned the lights back on in her mind. Sleeping pills, like Zolpidem or Ambien. It's tempting. Just pop a pill and drift into sleep. But many sleeping medications are sedative hypnotics, meaning they not only make you sleepy, they also slow down your brain function. These medications enhance the effects of GABA, a neurotransmitter that essentially puts the brakes on brain activity. While this helps with sleep in the short term, over time it can disrupt the natural sleep cycles your brain relies on for memory consolidation. Studies have found that seniors who take these drugs long-term are at significantly higher risk of memory loss and falls. In fact, one study found that regular users had a 30% higher chance of developing cognitive impairment compared to non-users. Better alternative? Cognitive behavioral therapy for insomnia, CBTI, or natural melatonin supplements. Proven safer. For aging brains, CBTI addresses the underlying causes of sleep problems rather than just masking symptoms. Benzodiazepines like Xanax, Valium, Ativan. Anxiety, stress, insomnia. Benzodiazepines are often prescribed to calm symptoms. But over time, these drugs literally rewire the brain's chemistry, making memory problems worse. Benzos enhance the effect of GABA in the brain, similar to sleeping pills, but often more potently. This suppresses the activity of brain regions involved in forming and storing memories. One long-term study revealed that seniors who regularly used benzodiazepines were 51% more likely to develop Alzheimer's. The risk increased with higher doses and longer use. If you're using them now, don't panic. Never stop suddenly. Talk to your doctor about safe tapering and healthier anxiety management strategies like mindfulness practices or therapy that won't compromise your cognitive health. Antipsychotics, like Seroquel, Risperdal. Originally created for schizophrenia and bipolar disorder, antipsychotics are sometimes used in elderly patients with agitation or dementia itself. Ironically, they can worsen cognitive decline. These powerful medications work by blocking dopamine receptors in the brain. While this can help with certain psychiatric symptoms, dopamine is also crucial for cognitive function and motivation. They act like a chemical straitjacket, sedating the brain at the cost of mental clarity. The FDA even issued a black box warning about their use in seniors with dementia, noting an increased risk of death. Safer options: gentle environmental modifications, therapy, and, if needed, certain antidepressants under close supervision. Simple changes like consistent routines and adequate lighting can often manage problematic behaviors without high-risk medications. Statins, like Lipitor, Crestor. Statins lower cholesterol, and they save lives. But some seniors experience what doctors call statin-induced cognitive dysfunction. The brain contains about 25% of the body's cholesterol, which is vital for proper neuron function. When statins significantly lower cholesterol levels, some people experience cognitive side effects. Symptoms can include sudden forgetfulness, confusion, and feeling like your brain is slipping. Patients often describe it as a cotton wool feeling in their head or difficulty finding words. News. For many, switching to a different statin, lowering the dose, or using non-statin options can help. The cognitive effects are usually reversible when the medication is changed or discontinued. Antidepressants, especially tricyclics like Elavil. Depression is common among seniors, but some antidepressants from older generations can block acetylcholine, just like antihistamines do. Tricyclic antidepressants such as amitriptyline, Elavil, were among the first medications developed to treat depression. While effective for mood, they have significant anticholinergic properties that can impact memory and cognition. If you're noticing worsening memory while taking an antidepressant, it's worth reviewing with your doctor. Newer options like SSRIs tend to be much more brain-friendly and generally safer for cognitive function. Some patients even report improved cognitive function when depression is properly treated, as depression itself can cause significant memory and concentration problems. Bladder control medications, like oxybutynin. Bladder issues can be frustrating, but the medications often prescribed to calm an overactive bladder come with a major downside. They're potent anticholinergics. These medications work by blocking acetylcholine receptors in the bladder muscle, reducing contractions and urgency. Unfortunately, they can't selectively target the bladder. They affect acetylcholine throughout the body, including the brain. Many patients report memory loss, confusion, and mood changes after starting these drugs. In one study, patients taking oxybutynin performed worse on memory tests within just a few weeks of starting treatment. Newer bladder treatments or physical therapy may offer relief without the cognitive side effects. Some newer medications like mirabegron work through different mechanisms and don't have the same impact on brain function. Opioid painkillers, like morphine, oxycodone. Opioids don't just dull pain, they dull the mind. Chronic use, especially in seniors, has been linked to confusion, memory problems, and even increased dementia risk. These medications alter brain chemistry in complex ways, affecting multiple neurotransmitter systems involved in cognition. They can cause sedation, disrupt sleep patterns, and even lead to hormonal changes that impact brain health. If pain control is needed, doctors now encourage multimodal strategies: physical therapy, acupuncture, or safer medications wherever possible. Many patients find that a combination of non-opioid pain relievers, topical treatments, and physical interventions can provide sufficient relief without the cognitive risks. Proton pump inhibitors, PPIs like omeprazole, Nexium, heartburn relief at what cost? Long-term PPI use has been associated with increased risk of dementia in some studies, possibly by reducing the absorption of important nutrients like B12, vital for brain health. These medications powerfully reduce stomach acid, which unfortunately also reduces our ability to absorb many nutrients critical for brain function. Vitamin B12 deficiency, in particular, can cause symptoms that mimic dementia. A major German study found that seniors who regularly used PPIs had a 44% higher risk of developing dementia compared with those who did not take the medications. Simple. Alternatives like dietary changes, probiotics, and occasional use of antacids could help protect your memory while still managing acid reflux symptoms. If you or someone you love is taking any of these medications, don't panic. Many drugs are necessary, but it's critical to review them regularly with a doctor who understands senior brain health. Always remember, never stop any medication without medical supervision. The risks of abruptly stopping certain medications can be serious or even life-threatening. Small changes today could mean a clearer mind, sharper memory, and a fuller life tomorrow. Consider bringing this information to your next doctor's appointment for a medication review. Before you go, if you found this video valuable, type PROTECT in the comments. Tell me, were you surprised by any of these medications? Have you or a loved one noticed memory changes after starting a new drug? If you haven't already, subscribe to our channel. Your support helps us create more videos that empower you to live your healthiest, sharpest life.